The STS Gen2 consists of 3 integrated telescoping pole segments, a black lower leg pole, silver mid-leg pole, and the red traction pole. There are 2 attached straps on the STS, the black ankle proximal calf strap and the red groin strap. The traction mechanism for the STS is found on the innermost red pole. It consists of the traction cord, V-notch to lock the cord, and an additional securing cleat for the traction cord. The STS can be extended by pulling on the silver middle tube from the black outer tube until the spring button locks into one of the 2 extension positions. Fully collapsed is a 3rd setting option for smaller patients. Or if there may be concurrent lower extremity trauma, position the STS lateral to the injured leg so the straps are at the appropriate ends for the patient, and extend the splint to a length matching the injured leg of the patient. Wrap the ankle strap around the patient's ankle and secure it with a hook and loop. The ankle strap is long enough to accommodate anything from a pediatric patient to an adult ski boot in diameter. For skiers, you may choose to apply proximal to the boot as well. Slide the male buckle of the red groin strap under the knee and up into the patient's upper thigh region. Attach the side release buckle, keeping the buckle pad under the buckle for patient comfort. Ensure no objects are under the groin strap, such as keys or a wallet. Tighten the strap to remove any slack. Note the "Towards Groin" sticker. Gently pull the traction cord, placing traction on the leg until pain is relieved. It is likely your patient will feel relief with less tension than you may have trained with on your own leg. Most people feel relief with only 5 to 15 pounds of traction. Your target is pain relief. If your patient does not report relief, then adjust and readjust as needed. To lock the traction, simply slide the cord into the V-notch on the red pole, which acts as a lock mechanism. Wrap the end of the cord around the wings of the integrated cleat in the red pole to secure it into place. Adjustments to traction can easily be made by unwrapping the cord from the securing cleat and applying tension again to the cord. This will release it from the V-notch, and then traction can be easily adjusted. To re-secure traction, repeat the locking process. If there is trauma below the knee, femur traction is typically contraindicated as we cannot apply traction force to the femur from the ankle. In these cases, the ankle strap can be wrapped around the proximal calf, just distal to the patella. Extend the STS poles to position the ankle strap at the proximal calf. Wrap the ankle strap proximal to the calf or patella and secure using the hook and loops. Apply traction normally using the traction cord and lock. With the STS applied to the patient's proximal calf, the lower leg is accessible for splinting and stabilization using a variety of splinting devices. The Slishman pressure wrap is included with the STS to assist in rotational stability during patient evacuation and transport. Wrap the Slishman pressure wrap around the patient's feet to help stabilize the legs from rotation during transport. Loop either foot with the loop of the elastic wrap. Wrap the feet together and fasten the pressure wrap using the hook and loop fasteners. This provides rotational stability and limits movement of the lower legs during evacuation and transport. For shorter patients or pediatric patients, the STS can be applied without the poles extended. The application process is the same.